So you come into my doctor's office and you say, Dr. Amayo, I feel exhausted all the time, even though I'm sleeping well, I'm eating properly, I don't feel particularly stressed. So why am I so tired? This is something a lot of people struggle with, and in this video I'll walk you through the medical causes of persistent tiredness that a doctor would usually want to rule out. One of the medical causes we think about is an endocrine problem. The endocrine system is essentially the body's chemical messaging network. You have these hormones released into the bloodstream and they act like signals. They tell different parts of the body how to behave. If that system isn't working properly, it can affect lots of things, and tiredness is often one of the first symptoms people notice. In someone with unexplained fatigue, there are two endocrine problems I'd particularly want to check on early on. The first is a thyroid problem. The thyroid gland helps control the speed of your metabolism, and by that I mean all the chemical processes that keeps your body running. You can think of the thyroid gland like an accelerator pedal. When it's pressed down, everything speeds up. When it's eased off, things slow down. If the thyroid isn't producing enough hormone, the whole system slows, and that drop in speed often shows up as low energy and persistent tiredness. If a doctor's concerned, this is usually checked with a simple blood test, but I'll tell you most of the time this comes back normal. But it's worth checking just in case. The other issue we'd want to check for is diabetes. This is another endocrine problem that doctors want to rule out in cases of unexplained tiredness. In diabetes, to stick with the car analogy, we have a fuel problem. The issue isn't a lack of fuel, the body has more than enough of it, but it's really struggling to get that fuel where it's needed. And for our bodies, that fuel is sugar. So if you have a problem with the pancreas and the hormone it produces called insulin, sugar can build up in the bloodstream, but it won't be able to get into the cells properly. And if sugar can't get into the cells, they don't have the energy they need, which can leave you feeling persistently tired. And this can be checked with a blood test if needed. Now, to be clear, there are other less common endocrine causes of tiredness, but diabetes and thyroid problems are usually the first things your doctor will check for. At the same time I'm thinking endocrine, I'm also thinking about nutritional deficiencies, because you don't just need fuel, you also need the right kind of fuel. And if you're low on certain nutrients, it can have a real impact on how much energy your body has. For example, there's vitamin D, which supports your immune system, helps keep bones healthy, and plays a role in muscle function. Low levels can sometimes leave you feeling tired. And iron, which is super important because it helps carry oxygen around the body, and alongside vitamin B12 and folate, it's essential for making healthy red blood cells. Now, these cells are vital for delivering oxygen to your tissues, so low levels can leave you feeling quite tired. Which brings us to another cause of fatigue, and that's anemia. Anemia is when you don't have enough healthy red blood cells to carry oxygen around the body, and nutritional deficiencies are a common cause of this. But blood loss can also play a role, for example, through heavy periods or through slow blood loss somewhere else in the body. This can also, you guessed it, be checked with a simple blood test. Moving on to the next issue, post-infection tiredness. Of course, we all expect to feel tired when we have an active viral illness, but some infections can leave you feeling exhausted for weeks or even months after the infection itself has cleared. We saw this a lot with COVID, but other viruses can behave in a similar way. This is where taking a good history really matters. If your tiredness started after an infection and you never quite felt like you recovered, that's important information for your doctor to know. This kind of tiredness doesn't always show up on a routine blood test, but if the history really fits, a doctor might consider checking for certain viruses like EBV or CMV. Another thing I'd be thinking about if you came to see me in clinic with tiredness is whether there's an issue with your gut. The gut plays a big role in energy because it's where we absorb the fuel and the nutrients our body needs. If there's a problem with digestion or absorption, it can reduce how much energy your body actually has available. And if that gut problem also causes ongoing inflammation, that can be an additional drain on the body's energy. This is where taking a good history really matters. Things like bowel habits, appetite, weight changes, or abdominal pain can all give clues as to whether the gut is playing a role. For example, conditions like celiac disease, which is an immune reaction to gluten, food intolerances such as lactose intolerance, or inflammatory bowel disease can all sometimes play a role either by affecting the nutrient absorption or by causing ongoing inflammation. And your doctor may consider a stool test or a blood test if there is a good clinical suspicion. Of course, I'd also be looking at any long-term health conditions you already have to see whether any of them could be affecting your energy levels. When organs like the heart, the lungs, the kidneys, or liver aren't working as efficiently as they should, the body has to work harder just to keep going, and that extra strain often shows up as fatigue. That's why I'd also want to make sure that nothing new has developed involving any of the major organs. And this is again where a careful history and examination is vital. Most of the time it helps us rule out anything serious. I'd also review any regular medications you're on because some treatments can affect energy levels, especially when taken long-term or in combination. If the history or examination raises concern, your doctor may consider doing blood tests or further checks to look at the heart, lungs, or kidneys. Next, we come to sleep disorders. This is a big area, and I'll cover sleep in more detail in a separate video. But one of the most important medical conditions I think about in the context of fatigue is sleep apnea. Again, the history is key here. Things like loud snoring, unrefreshing sleep, or waking up suddenly at night feeling short of breath can all be important clues that sleep quality isn't as good as it should be. I'd also think about any health conditions that might disturb your sleep, as they can also play a role too. Things like restless leg syndrome, for example. And then we come to inflammatory and autoimmune conditions. With chronic inflammation, the body is geared up to fight something, whether that threat is real or not. With autoimmune conditions, the immune system makes a mistake and becomes geared up to fight the body itself. In both situations, the immune system stays switched on when it shouldn't be, and that ongoing activation uses a lot of energy. It's worth noting that people don't usually come with tiredness alone when it comes to inflammatory or autoimmune conditions. They usually have things like pain or inflamed joints, problems with connective tissue that supports the muscle and bones, or symptoms affecting the skin or blood vessels. But because these conditions involve ongoing inflammation, fatigue is often a prominent symptom. Again, if there's strong signs in the clinical history or examination, your doctor might consider doing a blood test to look into this. Chronic pain is another important contributor to fatigue. The fact is, living with ongoing pain puts the body under constant strain, and over time that can drain energy and lead to persistent tiredness. It can also affect sleep and mood, which in turn can have a direct impact on energy levels. Lastly, we come to the group of causes that most people worry about, but which actually accounts for only a small proportion of cases of unexplained tiredness, especially when fatigue is the only symptom. These include serious underlying illnesses such as cancer or chronic viral infections like HIV or hepatitis, and it's always important to get checked out if you're concerned. But it's also important not to spiral or go in circles worrying about these causes in the absence of other symptoms. The kind of features that would push these higher up in the list are things like unexplained weight loss, night sweats, or a persistent fever. And if you're ever worried, the right thing to do is to speak to your doctor and be open about your concerns. That helps guide what needs to be checked and when. It's worth remembering that most of the time, tiredness is not due to a medical problem, and we'll talk about that more in a later video. And even when there is a medical cause, it isn't always something serious. In most cases, it makes sense to start with the basics and work up from there, rather than jumping straight to worst case scenarios. So I hope that's been helpful. This has been Medicine Made Clear with Dr. Amayo.